Will you please explain to us your re-exam process?
Absolutely. The exam is really the foundation of case management, and really helping to manage the patient's expectations and those stops along the way. So prior to a re-examination, so let's say that we're now a month into the care plan, and we're ready for the re-examination. What we do is the night or the visit before the re-examination, we give the patient some questionnaires to fill out, and to take that and have those filled out prior to coming back on their next visit. You need to meet with the billing staff, and you need to find out exactly the plan that you put into place. How's it going so far? Have you billed out the number of visits that were expected? What's been the insurance's response to that? Are they there's a payment coming in, and really where is that? Also reviewing the patient's their frequency of care. Have they kept up on their bargain? Have they been getting in and to their visits at the frequency that you set? Are they making up missed appointments? And it's important that a patient understands that if after 4 weeks we want to have 12 visits in to get a certain expected result, but they've only been here 6 times, then they're not going to be as far progressed as they can be. So in the re-exam process, in the initial exam on that first day, we've gone through and did functional tests. So we tested their range of motion, orthopedic, neurological evaluations, postural evaluations, and we actually quantify the number of tests. So for an example, let's say that they had 50 positive tests. Now, a test, when we say positive, I make sure a patient understands that positive is not a good thing in this case. So they're bad tests. So there's 50 tests there. We take those and divide those tests into 100. So if they had 25 positive tests, it would be worth 4 points. If they had 50 positive tests, it would be worth 2 points. Now, on the re-examination, once the questionnaires are all filled out and the patient comes back, we're going back through all 50 tests. And we're looking to see which tests are now within a normal range. As those tests are now in a normal range, we're now recalculating how many positive tests they had. So let's say that 10 of those tests got better. So on the re-exam now they have 40 positive tests. Well, we have 10 improved. So if we take 10 times 2, we have a 20% improvement. Now, we plot that on a graph for a patient and really explain to them that inflammation begins to settle down around 20%. But if we just stop when we are only at 20%, or the symptoms or inflammation is settling down, and function isn't restored, how long will they stay out of pain? And they get to kind of understand that process again. Now, in the correction process, we're going to continue to work with function. And so I go through the re-exam process now with them, and I show them what's improved. So your range of motion, in your initial test, you had 10 positive tests there. Now you have 6. In palpation, pushing on the spinuses in the tender areas there, you had 15, and now you have 7. And I go through and show them what's improved. You had 5 orthopedic tests, and now you have 2. And then as we look at moving forward, I want to go through with them and let them know, now here is what hasn't improved. This is the specific therapy that we're going to work on here in the office, and these are the things that I'm going to have my staff train you on, and here's what I want you to advance at home. These are the things I want you working on and focusing on at home. Once we've established those parameters and we're moving forward, then we discuss really their frequency of care, if there's any problems there. I confront that with the patient, ask them how they're doing with their schedule. Are they running into any difficulties? If they are, what can we do to help manage that? And then also reviewing their finances with them. Here's the plan that we set out. Here is what your insurance has been doing at this point in your care. If there's any changes that we need to handle the finances right there. Again, we want to maintain that trust with that patient all the way through care. And one of the worst things you could do to a patient is get to the end of their care and say, oh, hey, by the way, you owe me another $1,000 because we found out your insurance wasn't paying 3 weeks ago or a month ago and we failed to tell you. So you got to maintain that trust with that patient. So handle those in the re-examination. Establish that trust. And then always finish with revisiting their goals. Making sure that their goals haven't changed. Reminding them of what their goals are. And then taking them out, getting them scheduled to the next re-exam. And really helping to manage that.